this is Layla. We are in Fortis. Fortis Memorial Research established in 2013. FMRI is an advanced center of excellence in robotic surgery, neuroscience oncology, renal science, BMT, organ transplants, orthopedics, cardiac sciences, and obstetrics and gynecology. Set on a spacious 11 acres campus with the potential to grow to 1,000 beds. And interestingly, there was majority of professional doctors and nurses in this Fortis. Today, we are going to get interview from Dr. Ashish. This is Dr. Ashish Singhal, and he's a liver transplant surgeon. He has more than 12-year experience in liver transplantation field. Dr. Ashish Singhal, liver transplant surgeon, senior consultant, and he was formerly working as attending surgeon at Allegheny General Hospital, Pittsburgh, USA, and assistant professor of surgery at University of Cincinnati Medical Center, Cincinnati, USA. Dr. Atil Kumari Mittal, consultant Fortis Hospital, Mohali. Well, I have first question. My first question is about, you have taken lots of surgeons throughout your experience, and which was the hardest one for you?
Good morning, Leila. Thank you for being here and doing this interview. And I'm in this field of liver transplantation for more than 12 years, and liver transplant itself is considered to be one of the most difficult surgery. And even in my 12-year experience, the most difficult cases, if we talk about the adult liver transplantation, are the patients who are very sick in ICU. From the medical standpoint, they are on ventilator, they are on dialysis. So they may not be difficult from the perspective of surgery, but they are difficult to manage pre-transplant, intraoperatively, and post-transplant. From the surgical perspective, the patients who had multiple episodes of infection in their abdomen, patients who had previous surgery, patients who has thrombosis of their vessels, whether it's a portal vein or outflow, or the difficult bleeding anatomy from the donors. Those are the difficult patients. And apart from adult, if you look at the pediatric population, from the kids, children, the small kids less than 5 kg, kids less than 6 months, they are difficult small babies. So to open the belly, their vessels are very small. These are very challenging cases to do the surgery in terms of the surgical skills. But having said that, with the experience, you overcome these issues with the team and help of your anesthetists and other team members.
Thank you. And also, you are the member of the International Liver Transplant Society, ILTS, an American Society of Transplant Surgeon, ASCS, an American Hypopancreatic Biliary Association, AHBPBA. And you have published more than 35 national and international publications, right?
Yes.
That's great
Thank
achievement.
you.
And at present, you work in Fortis Memorial Research in Gurgaon and Delhi and in Noida. Why did you exactly choose this Fortis Memorial Research in order to develop your career?
So I chose the team. Headed by Dr. Vivek Vij. He's an excellent surgeon. He's one of the best surgeons in the country for liver transplantation. And so basically I chose and I wanted to join him as a team member. And with that, I chose to the former FMRI Gurgaon. Having said that, our team works in a way that we cover 3 centers within the Delhi NCR region. So the senior sons of surgeons, they rotate, travel to other centers too to do the surgery. Though I stay in Gurgaon, my primary responsibility is Fortis Memorial Research Institute Gurgaon, but I equally am involved in the surgery happening in the other center at Fortis Escorts, Delhi, and Fortis Noida.
That's great. Well, let's back to your student period. And your education is about, you have finished MBBS, Himalayan Institute of Medical Science, Dehradun, Diplomate of National Board Surgery, Sir Ganga Ram Hospital, New Delhi, DMBA. Postdoctoral Research Fellowship, Nazir Zuhdi, Transplant Institute, Oklahoma, USA. And Clinical Fellowship in Transplant Temple University Hospital, Philadelphia, USA. ASCS Fellowship in Transplant Surgery, Kidney, Liver, Pancreas, University of Cincinnati Medical Center, Cincinnati, USA. And the interesting question is that why exactly you choose this liver transplantation field, but not others?
To be honest, I always was fascinated with the field of transplantation because this is one of the specialty which gives a new lease of life to a patient who is suffering from chronic diseases. So to begin with, I was very much impressed with the kidney transplantation because my father had a kidney transplant. So I saw the difference that his life changes while from being a time he was on dialysis to have a successful kidney transplant, and he was kind of up and about doing everything what he was doing before going on dialysis. So that brings me when I was in medical school. So but then after finishing my general surgery residency, I was trying to get into oncology, and then liver transplant was kind of coming up in India. There was people still, it's new programs are coming up. So I thought that, but I saw it was just starting and the results are coming better and better. So at that point of time, again, I joined Dr. Vivek Vej and other team members to start my career in transplant. I was so happy to see the patient who were walking with the yellow eyes, jaundice, water in the belly, and confused, and they're walking out with a new liver and looking as normal as they were before getting sicker. So you can see the results immediately. You can have seen people who have been out of transplant for more than 20 years and they're doing what they should be doing otherwise in their lives, and spending time with their families and giving productive years to their family and society.
Well, thank you so much. And the last not least question, what's your future aims?
So my aim is to provide liver transplant services to as much as people we can. The aim is to save as much as lives we can in the people who are suffering with these chronic liver diseases. To educate and to train more people and the next generation of surgeons so that they can continue this legacy of liver transplantation, and to train people from abroad where these services are not available. And the other aim is to make our team and our center as the best center in the world with the best survival rates and least complications.
Thank you so much. Our guest was Dr. Ashish Singhal, and my name is Hoshima Lailo. You can call me Laila. Thank you.
Thank you.
Thank you so much.